That's their take. You've spoken to former Trump health officials throughout this pandemic. When you hear this, when you see 2 years later cases still spiking, lines still forming, just to get tests, what stands out to you?
Well, what stands out to me reporting on this sort of consistently and talking to these officials that I think in the beginning there was a desire to sort of downplay this, to say, hey, maybe this isn't going to be as serious as we think, which I think a lot of people sort of realized that was happening, and there was a lot of wishful thinking. I think what is sort of striking from this report and also some of the interviews that I've done is that became increasingly strategic. The idea of saying, hey, people who don't have symptoms don't need to be tested, despite the fact that we know much of, if not most of the spread was coming from asymptomatic people. And then also just really curtailing the amount of time officials could speak about this. They had to get permissions oftentimes, they couldn't get those permissions. It was really challenging. I asked Dr. Deborah Birx about this specifically for this documentary.
Coming up on 6th Avenue.
Were you being censored?
Clearly someone was blocking me from doing it. My understanding is I could not be national because the president might see it.
That's sort of an example of what it translated to, I think, for people like Dr. Birx, but even Dr. Fauci, who said they were ready to present a new plan in terms of how to progress with the pandemic. And around the same time, tweets were going out saying, liberate Michigan, liberate Virginia, very much at odds with what the scientists were saying.
President Biden has offered a clear warning that if you're unvaccinated, you're looking at a winter of severe illness, maybe even death. What's this winter going to look like for those of us who are vaccinated, even with the boosters?
I think you're going to be far less likely to get sick. I mean, you should feel pretty well protected if you're vaccinated and boosted. But let me show you
Kimball.
So if you look at vaccinated, unvaccinated with regard to hospitalizations, and Jake, as you know, I think the hospitalizations ends up being the truest metric of things. It's so tangible. Are hospitals becoming overwhelmed or not? The vast majority, as you can see, the red line, that's unvaccinated patients with COVID in the hospital compared to the green line. What happens, Jake, if these hospitals do start to get full, the tangible impact on people in society is that the hospitals may go on diversion. They may not have enough beds. Harder to take care of trauma patients, harder to do elective operations, things like that. So that impacts everybody. So that's, even if you're vaccinated, that could have an impact on you. And also, just look at Omicron versus Delta for a second. Everyone says this is more contagious, but I want to show you what that means based on some of this data we're seeing out of the UK. What they found was that to get to 5,000 Omicron cases, this is in England, it took 20 days. For Delta, which is super contagious, it took closer to 70 days, 75 days to get to that same number. So